and consent that the following information will be gathered and utilized for the educational purposes by Indiana Wesleyan students. I allow this information gathering and the physical assessment to be videotaped and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Hi, my name's Nikki. I'm the RN taking care of you today in the ER. Do you mind telling me your first and last name?
Jane Smith.
Okay, and what's your date of birth?
January 1st, 1950.
Okay, what brings you in today, Miss Smith?
I've been having horrible stomach pain
How long have you been having this pain?
since yesterday morning.
On a scale of 1 to 10, 1 being the least amount of pain and 10 being the greatest amount of pain, can you give me a rating?
9.
9. Does anything you do relieve this pain at all?
No.
Nothing. Have you had any other symptoms along with this pain?
Diarrhea, vomiting, nausea, and I think I've been running a fever.
Well, when they triaged you today and they took your vital signs, they did see that your temperature was 100.7. How many episodes of diarrhea have you had?
5 or 6, and the last couple have had blood.
Do you have a history of hemorrhoids at all?
No.
How has your appetite been?
It's been really good until yesterday when I went to the movies and had popcorn, and then this pain started, and it's just been terrible.
Overall, what's your typical diet?
Mostly fast food. I don't cook very much at all.
Okay. Well, I'm going to examine you now based on your symptoms. Would you mind laying down?
No.
I'm going to lift your shirt up just a little bit, okay? Just to
Okay.
see your abdomen. Okay. Now your abdomen appears a little distended. Is that normal? Or
No.
Is it, no? Okay. I'm going to listen to your bowel sounds now. They are sounding pretty hyperactive. Next, I'm going to palpate your abdomen. You let me know if there's any pain, okay? All right. Is
Yeah,
you
that
having
hurts.
pain right
Yes,
there?
yes.
Okay, in your left lower quadrant. Okay, let me put your shirt back down here. Well, we also were looking at your blood work that you had when you first came in. And it looks like your white blood cell count was elevated, which usually indicates an infection of some sort. And then also your hemoglobin was pretty low at 7.5, which means that you could be having a bleed, which you did say that you were extruding some bright red blood in your stool. Based on these findings, we're going to run some tests to see if you possibly have diverticulitis. Your symptoms are pointing in that direction. First, we're going to obtain your labs from your primary doctor to see what your baseline of your hemoglobin was, if it has been chronically running low or if this is something new. Also, we're going to do a urine test to rule out if you possibly have a urinary tract infection or something else. And also, we're going to run a CAT scan of your abdomen, and this will definitely let us know if you have diverticulitis. Do you have any questions?
Yes, what is diverticulitis?
Well, it actually starts as diverticulosis, which is in your colon, if you don't eat a real high fiber diet, you have nothing pushing the food through. So you will start to develop these pouches, which are the diverticulosis. Those pouches can sometimes get food stuck in there, like like you said, you had popcorn nuts, things like that can get stuck in there and then cause an infection. So, and can possibly rupture and cause a bleed. So what we'll do if it is diverticulitis is the doctor will order you some IV fluids and some IV antibiotics and also some IV pain medicine to help. We will also give you a very low residue diet, start out as a clear liquid diet and then move up, just so that your colon can get a rest and get that through. Most times the bleed will resolve itself and everything will be fine. We will have a GI doctor also consulted to look and see if there's anything further that needs to be done for you. Once that's done, we'll also educate you on eating a more high fiber, healthier diet so this doesn't hopefully happen again for you. Okay?
Okay, thank
All
you.
right. All right, thank you very much.